of what the patient is going through, and you are a very real communication device who can inform patients and the medical specialists about alternatives that are indeed, as you say, and kinder and gentler.
And I really believe that nurses have a key role in terms of assessing for complementary medicine use and beginning that dialogue with patients and asking about the various therapies, both conventional as well as complementary, that patients may be using, ensuring that that gets documented into the patient records so that the whole healthcare team is aware of what that patient is using or perhaps interested in using. And I really believe nurses play a key role in shared decision making and referring patients to evidence-based resources, websites where they can actually look up information that's reliable and credible and be able to make decisions that are informed. And my research program in Vancouver and now in Toronto has been really focused on advancing nurses' skill set and their knowledge so that they're able to play that key role in the clinical setting.
And I think we've already identified some of the barriers for the underutilization of integrative medicine therapies in our cancer patients, and that is that very often, even if they exist within the cancer center, they are not known about. And so I really look at nurses as a liaison, as an integral part of the team in which they educate themselves, know what the services are that are offered within the cancer center and within the community, and how to make those really essential referrals, how to make those kind of suggestions to the providers if they need a referral. And so I truly look at them as an essential liaison to kind of make the connections that are needed. And then additionally, I really look at nurses as catalysts for this wave of change in integrative medicine. That what administrators and practitioners really need is excitement for these therapies for our patients. And I think if they start hearing this from the nurses, that they'll realize that the patients are asking for these services, that they want these services. And it's clear, once they are aware of that, that there's a research deficit. And once they are aware of that, it's also clear that there's more and more money coming for these kinds of research endeavors. And so I think from a bottom-up kind of strategy, if the nurses can kind of be this liaison and be this catalyst for change, that it really can make a big impact on how integrative medicine is utilized in cancer centers.
Wonderful. Yeah, those were some really, really good points that we talked about, what all of us can do. So I encourage each one of us to go back and look what your center offers and look up online, look up resources that you can educate yourself. I believe ONS and ONCC, we have continuing education classes and workshops to learn about complementary and alternative medicine. And I think Liana and Linda can talk a little bit more about what our society offers in terms of educating to the nurses. And of course, anyone else, you have ideas, feel free to pitch in after that. So, Liana, do you want to talk about what resources are available for the oncology staff and where they can go?
Well, there's some really basic resources that are available. NCI and NCCAM have a nice little pamphlet that we keep in our clinic, and it's just